Hey there, my name is
Hello.
Tonya Callender. I am the co-owner of Houston Moms Blog. You've seen me here a couple of times before, actually a handful of times. This is part of our monthly health series with UTMB Health. And each month we are dedicated to bringing to you different specialties of what UTMB covers. And it's a special month because moms and women, it's all about you. So May is actually Women's Health Month. And so to speak to that and some things that we need to talk about on women's health, we are bringing in Tonya Callender, Dr. Tonya Callender, and she is going to fill you in on a little bit about who she is, what she does, and then we are going to talk about everything you need to know for Women's Health Month. Dr. Callender, thank you so much for being here.
Thank you, Megan, for inviting me, and I'm glad to be here and get to speak on this topic because I'm very passionate about it. I'm a nurse practitioner. I have been a nurse for over 30 years, and I also have been a nurse practitioner for now over 20 years. For the past 10 years, I've been in women's health. I actually landed a great opportunity in the Department of OB-GYN. It has been my passion to take care of women, and in this particular clinic, I get to work very independently and has been a great fit.
That's wonderful. And you are a mom as well, right?
I am. I have three. I have a 32, a 30, and a 24. Have two granddaughters and a third on the way.
Congratulations.
Thank you. Thank you.
That's so
Being a
exciting.
mom is the greatest joy ever.
It is, and hard too, right? Um, but you've kind of gotten on the tail end of that, which I think will help speak to some of our younger moms who are just now kind of getting into the trenches
Right?
and learning what it means to also take care of ourselves and not just our children.
Right.
So in previous months, we've talked pediatric gastroenterology, we've talked pediatric health, everything to do with our children. But we're going to talk about us this month.
Great. Awesome.
Okay. I am so excited. So, I think when people typically think of women's health, a couple of things come to mind. We think of the annual pap smear.
Right.
And then if we're getting over a certain age, we start thinking about the girls and mammograms and all of those sorts of things. So when you think of women's health, what do you think of? What does that look like to you?
So I see patients across the lifespan. I see from teenagers on up to, in the 80s. I actually have some 90-year-olds still. But when I think about women's health, primarily, in the teen years, you're worried about contraception. 20s to 30s, I think about more protecting women from the HPV virus. So discussing safe sex, vaccines, things like that. Um, so we start PAP screening at 21.
Okay.
Until a patient has become sexually active, there's no reason to do a PAP. Typically, if they're in their 30s, we might still go ahead and do one, but typically we don't start doing PAP screening until 21, and the majority of people are sexually active by that age. If the PAP is normal at 21, then we don't repeat the PAP but every 3 years. Now, that doesn't mean that we don't want you to come on an annual basis, but we don't have to do what we call the brush every year. If they're abnormal, then we do repeat the screening more often. But we like you to come because, one, that helps us to keep you in our panels and know more about you. But oftentimes then there's things that come up along the way. You need birth control, or you need become pregnant along the way, or then sometimes even after that we think about, if your periods are irregular, what we need to do to regulate things. In the 40s, then we start adding a mammogram. We recommend a mammogram every year. Some societies say every other, but we prefer every year. And then at 50s, we go ahead and start doing screening colonoscopies.
Okay.
So, and at 50 also, we recommend getting the shingles vaccine. And then at 60s, we start thinking about bone health, bone density, as well as then getting pneumonia shots. So that's kind of in a nutshell through these years, but then things come up along the way that we address as the needs arise.
Yeah. So even though it's pap smear every 3 years, you still need to go have those regular well checkups for women, because you're not just looking for that. Or, assume you're taking blood and we're monitoring blood pressure and we're looking at
Absolutely.
changing lifestyles and
Right.
all of that.
Yes. And we're addressing other issues too. As a young woman, you don't worry as much about urinary incontinence or fecal incontinence. But we also address those issues as they get a little bit older. Vaginal dryness comes to be an issue. And then you know, just any kind of abnormal bleeding disorders that we see a lot.
Okay. And I think there's a lot of I'm pretty open about my sort of like history and what have you. But I mean, I think there is a little bit of trepidation sometimes
Absolutely.
when women um they either don't want to go or we're not prioritizing ourselves.
Right.
So what would you say to that mom who's like, and especially with pandemic, because we put off going to the
Absolutely.
doctors and doing that. What would be your encouragement to our moms and our women to get in and be seen?
So it's the most dreaded exam of the year. But, when we're doing an exam, we're really looking at your skin. Women have a lot of skin disorders that they don't discuss. Feminine itching is very, very common. There's a lot of skin changes that occur down in that area. So, that's another thing that we like to address when you come. But, it's the most uncomfortable exam just because everybody's embarrassed. And I just had mine just recently, and I'm like, this isn't very much fun after all. But once you've done it, you get that clean bill of health. It's like, I'm so glad that I came and got that done. Um, and during the pandemic, especially, we try and do our best to still social distance. But one of the things that happened during the pandemic, not so much during with women specifically, but people did not seek health care, and more people died of heart disease and heart attacks because they did not get health care. So continuing to come is very important.
I
And
think
and
yeah, go ahead.
well, one thing I tell every woman that I see, and especially the young girls that for their first exam, you know what? The more you relax, the easier it is, the easier I can do my job. This whole exam takes about a minute and a half to be done. So just relax, close your eyes, whatever. Let me do what I'm doing, and then you're all done. It's easy.
It is. And I think it seems so intimidating. And I mean, I get a little nervous,
Sure.
but I just kind of go to my happy place for a minute. And then, a week later or however long, I get my results and I'm just so thankful.
Right?
I'm good.
Yes.
Um, there was something funny, and some of my moms on here will get this. No matter what, if you go for your pap smear, even though you're going to be exposed from here on out, you're still gonna fold your underwear and put it under your jeans
Yes, for sure.
because you still don't want that to be seen.
Absolutely.
Um, even though things are out for full view. Um,
Absolutely.
and so, it's just one of those things, the grin and bear it's
It is.
and incredibly important. So what
Absolutely.
I think is really unique about UTMB is y'all have an array of services within your women's
Right.
health department.
Right.
So tell me a little bit about what all you offer, because it's not just pap smears and
Right.
mammograms. Y'all have a concierge of services, right?
Yes, so I'm the director of the Women's Comprehensive Care Clinic. It is a new clinic that we started last June, so we're not quite a year old. But we have a very small suite, but our suite is very intimate and we offer a lot of services. So we have dermatology, psychology, mammography, bone density, colorectal surgery, menopause, gynecology by myself. I'm here every day. And then I have a physician who comes one day a week as well. And this is, surprisingly, I think it's the age group that we're serving. We are doing a lot of finding a lot of pathology that has needed to be addressed. Now, we don't do OB in this clinic, so we're kind of unique in that setting. And I think it's a little bit more of a quiet setting. So I think patients are really enjoying that. But in this building, right next door to us is urogynecology. We have cardiology in the building, endocrinology, neurosurgery. There is an OB group in this building, so pretty much anything you need, we can address. We also have plastic surgery, basically neck down and neck up. We have facial plastics. So we're trying to do the whole complete care, Botox, fillers, any kind of surgical procedures you might want, and addressing these feminine disorders maybe that women won't discuss in other places. Like most women aren't going to go to the dermatologist because they're having itching. They come to the gynecologist. So we have gynecology with dermatology who can look at these at the same time. So
that is such a good point that I didn't even think about, because it's like, which way do you go with that, and who do you talk to about that? For sure. In your office specifically, this concierge clinic is where?
we're at 250 Blossom. We're on the Clear Lake campus, and we're right next to the Clear Lake Hospital.
Okay.
So it's very easy access.
Well, and I love how you have all the specialists there. So that if you pick up on something, maybe blood pressure's high, maybe we need to see a cardiologist.
Right.
Y'all do a fantastic job about referring out. And then also it did catch my attention about the Botox. I mean, if you're gonna like get a pap smear, you may want to treat yourself with
Absolutely.
a little pampering. So that goes into just all inclusive
Right.
women's health, especially for the month of May. So I think that is a really, really great point. What else? What would you say is your passion for treating women? Why this? Why moms? Or I'm saying moms, but why women?
I think women in general feel more comfortable with a woman. Not to say that men don't do a very good job, because they do. And our menopause provider is a male, but when you leave, you're going to think he took care of everything that you could have needed. I mean, from head to toe. But I think women prefer women as a majority, and it's very nice to be able to relate on a personal level with a woman. I mean, I can say, I think you would do really well with an IUD. I've been through the procedure. I know what it's like. I would do it again. These are my experiences. And so I think it's very nice to be able to relate when not everyone can. And at my age too, I have been through that childbearing years. I'm unfortunately entering that next phase of my female health. So I can say, yep, those hot flashes, they start from the inside out. That is just not good. So we can help you get through that. So
And you need somebody to talk to. And as we've spoken with all of our physicians with UTMB, it's it's us just trying to like not be a strong, that's not the right word, as we want to appear that we don't need help as
right.
moms and women, because we're just supposed to be part of this hustle culture that does it all.
Right.
We can't be for our family unless we are healthy.
Absolutely. And that's the most important part, is that without taking care of yourself, you can't take care of anyone else. yes, we try, but if we're not good, we're really not at our best to take care of everybody else. One of the things also that we have is psychology. And there are women who won't go to see a psychologist because they're not going to seek one out. But since there's one here that we use in our clinic every day and we refer to, a lot of women will go and say, hey, I need a little bit of coaching through this tough time in my life. And they feel very comfortable to come to this location because it's non-threatening and it's not like going to a psychiatrist's office. Like everybody's going to know where I'm going.
Right.
So,
And they've already kind of established a relationship there.
right.
And that brings up such a good point. And obviously, we're talking about May as Women's Health Month, but it's also Mental Health Awareness Month.
Definitely.
And I am assuming that part of what y'all do at your annuals and when you see your patients, that you're kind of watching for those trigger signs that somebody might be struggling.
Yes, absolutely. And if you're not rushing through an exam and you have the time to just sit with your patient for a few minutes, you'll be very surprised at what they will open up about. I mean, this is never a boring job. There are some things that I could tell you that there's no way you could be making this up. But if you know your patient, if you take time to understand them and know them, you can help them with so many issues. And people will open up about their needs. And, we keep Kleenex in our rooms every day. And for some reason, it's like every day I'm handing you a new box of Kleenexes because people just, this is where they come and they're vulnerable because they're sitting here with no clothes on. But being able to open up, it makes them feel less vulnerable and they will talk.
Yeah.
So,
That makes me feel teary because I understand exactly what you're saying. If we're already in this vulnerable state and we're there and they ask, how are you really doing?
right.
Um, there's almost that barrier that's been broken down. And my personal doctor, I live a little bit further away from Clear Lake area, but she asked me one day, um, and I knew it wasn't great, but I hadn't had the time to really pick up the phone or just, take the extra 5 minutes
Right.
or even to know where to go. And
Right.
she listened to me.
Hmm.
And listening was like 90% of the,
Absolutely.
and feeling heard as a mom. And so I think that's a crucial point of what you all do. So then moms can also get the help that they need, whatever that looks like.
Hmm. It's very important. Mental health is hugely important, especially again when we're strapped, by our children, by spouses, by jobs. We're stretched very, very thin. And we think that we can do everything. And we want to be the superhero, super mom, but we have to take care of ourselves. So it's very important to take that time for you.
Absolutely. And not be the mommy martyr. And,
Absolutely.
and take that afternoon to be like, you know what? Like, I may be getting a pap smear, but I'm going to have like 2 hours by myself. And it's going to be glorious, right?
Absolutely.
So we just
Yes.
kind of have to look at the bright side, so for
Correct.
2 hours, you may have to do this, but you also are by yourself without other demanding needs.
Right.
Um, Tanya, is there anything else that you would like to add to mental, I say that because we were just talking about it, to Women's Health Month and what you would encourage?
Yes, I would. The thing that I think is very important is that women should exercise. And it's not just good for your bones, it's good for your heart, but as important as anything, it's good for your mental health.
Mm.
So women should make that time to really focus on getting 20, 30 minutes of exercise a day. And I think that's one thing. If there's any one thing I would recommend people do, that would be it, so that it will help you throughout your lifetime to be healthier. It's not all about shedding weight or um, you know, looking good in the bikini. We're past all that, but it's about being healthy and taking care of you. And that is, again, a little bit of me time, whether you do it by yourself, whether you do it with a group, but that is one thing you can do that is taking care of you.
It's the holistic approach, right?
Right,
So we
right.
don't have just like, I'm going to Destin in June and I need to fit in the swimsuit, which I'm totally guilty of, like falling into that trap. But the mental aspect of taking 20 minutes just for a walk, especially for my younger mamas who are listening, and you have a screaming colicky baby and the newborn and the toddler that's clinging to your knee, and your mental health will be better if you can
Absolutely.
go take that 15-minute walk. I think that's such sage advice, and probably advice that I need to take later on today.
Absolutely.
That needs to happen. I am so thrilled that you could join us today, and celebrating this very important month. Women are important every month, but it's especially important that we be cognizant for our health this month, for ourselves, for our families. And so again, Tonya, thank you so much for being here. I want to remind all of you, we will post the links below as to where you can find this amazing concierge service, and make sure that you get scheduled for all of her annual, and making sure that you're following up with your doctor. And we highly, highly encourage you to continue having your conversations with your general practitioner, and especially women. You need to go get yourself taken care of, and this is the month to do it. And if you do, comment below too. Be like, I got mine. I got my mammogram this month. I got my pap smear this month. Comment below and let us know. Until next time, we will see you soon. Take care.
Thank you.